I completed my psychology training for my doctoral degree in 1980, became licensed in 1982. I completed a 3-year postdoctoral fellowship in neuroscience after I graduated. And then in 2004, I completed my postdoctoral master's in clinical psychopharmacology program. And a couple years after that, I became board certified also in behavior analysis. I'm a professor of clinical psychology at Alliant International University. And most of my research career has been working in the neuroscience of autism and neurodevelopmental disorders. I believe part of having a doctoral degree is a commitment to lifelong learning. And that's one of the things that actually differentiates the doctoral degree from a master's or a bachelor's. A doctoral degree also suggests that you have the ability to develop science and to take science and incorporate it with other areas of science maybe outside your field. So a doctoral degree prepares one way beyond just being able to apply science, but being able to be the creator of it and the evaluator of science. The postdoctoral master's program is a true master's degree. It's as complicated and as difficult as getting any master's degree would be, and maybe more so in some ways. And it requires a commitment to being back in school, taking classes, studying, taking examinations, and it's a commitment that then leads to a whole new area of knowledge above and beyond what you would have had your core training in. Well, the primary prerequisite is having a license as a clinical psychologist. So the model of training is training licensed clinical psychologists, people who are already trained to provide mental health services and to diagnose patients. We do make some allowance for admitting people who are very near completing licensure, and we'll take them in as long as, but they have to complete all their licensing requirements while they're in the program. Degrees in psychology don't require as much basic science to get into it, but that's made up during the doctoral program. And for people to go ahead to get the postdoctoral master's science, the basic science is part of the core curriculum in areas of neurochemistry, biochemistry, neurophysiology, neuroanatomy, pharmacology. Those are all core basic science classes that have to be taken at the beginning of the postdoctoral master's. So we do it, the sequence is a little different how we do it, but it gets incorporated at that level. Critics suggest that there's a need to have a broader undergraduate curriculum analogous to a pre-med curriculum in order to be able to prescribe safely. I don't think there's any data that suggests that that's true. I don't think there's any outcome studies that connect successful prescriptive practice with your undergraduate experience. And I think that, is there a value in having more basic science? Sure, it wouldn't hurt at all, but I don't think that there's any evidence that it's a necessary or would need to be a required ingredient. So the concern about there being crash courses to prescribe medication or to complete the training, or that online training is inferior to classroom training, there's also no evidence that that's true. They're definitely not crash courses. We're talking about a complete master's degree program that takes about 2.5 years to complete. And the courses happen on a regular and continuous basis. There's a very clear course sequence that's been carefully thought out by the American Psychological Association Committee on designating these programs. So it's a very thoughtful process. The, the model of training is that in psychology, we're doing that after there's been extensive training in not only the diagnosis of mental health disorders, the foundational parameters under which research was done to even evaluate the nature of what we call mental disorders, the types of training and therapies and treatment and behavioral theories that are present. So psychologists have largely invented most of the behavioral treatments for psychological problems. The postdoctoral master's program adds the biological training and the foundational training in the neuroscience for the basis that you need for a pharmacology intervention. So the design of the program is different. We're not trying to copy what medical schools do. We have a different model. So the issue of whether psychologists lack training to treat special populations or people that have concurrent medical conditions, well, first of all, psychologists already treat special populations, and they apply behavioral treatments to those populations. There's a considerable literature on that, and both in the core medical literature that psychologists contribute to, and in literature that's primarily developed through the field of psychology. So the postdoctoral Master of Science program in psychopharmacology at Alliant International University is accredited through the Western Association of Schools and Colleges. That's our regional accreditation body that accredits all our master's and doctoral programs. It's also a program that's been designated by the American Psychological Association as one of the 4 programs currently in the country that can offer this level of training to graduate students. So while the postdoctoral psychopharmacology program at Alliant, which is the program that I'm the program director for, primarily takes in clinical psychologists that want to get advanced training in psychopharmacology, we also have taken in psychiatrists that want to get additional training. We've taken in people that have their doctorate in pharmacology, PharmDs, into the training. And we've also taken doctorate level nurse practitioners into the training who want to get additional training. So the large portion of the students in our program are clinical psychologists. We do train people in other disciplines when they want to get advanced training in applied psychopharmacology. Faculty background that comes into teaching at the postdoctoral level are all faculty who hold faculty positions in other contexts. They range from being PhDs to MDs. Some are more basic biology type people and have their PhDs in biology or in chemistry. And they do their doctoral published work in those areas. So these are generally people who've been teaching a long time. The faculty in our program, probably the mean time of teaching our program is over 10 years per faculty member. So we have a group of faculty that have worked with our program for a long time, and they're specialists in their area of expertise. We really need to ramp up the number of people that are able to take on the significant need that there is in the country. And this just gives an additional avenue to a group of practitioners that already are licensed to diagnose and treat mental disorders. We need to give them this extra tool. And the other thing I want to say is we're not suggesting that psychologists have prescriptive authority. We're suggesting psychologists with a postdoctoral master's degree and another significant amount of training following that degree and supervision be able to prescribe. And I think that's a very important distinction to me.